And with the COVID vaccine now being available to children ages 5 to 11, doctors are stressing the importance of vaccinating your little ones. News 15's Kenny Darr spoke with 2 pediatricians about it as we head into the holidays.
Coming off of our 4th and most deadly surge when it comes to COVID-19 in children, Dr. Brian Sibley says the approval of the vaccine for ages 5 to 11 couldn't have come at a better time ahead of the holidays.
It's incredibly important, and the reason why is people tend to think that, that cold and flu season happens because it's cold outside, but cold and flu tends to spread, just like COVID, when people gather together.
This summer, Louisiana saw its worst spike in COVID-19 cases yet, stemming from the Delta variant, a more contagious version of COVID-19 than its predecessors, especially in children.
Yeah, the Delta surge is different than the other surges we've had. We had a lot more kids who were positive.
In July and August and September this past year was the worst part of the pandemic for children, especially under 10 years old.
18 people under 18 years old have died due to COVID-19 in Louisiana since the start of the pandemic, 9 of those deaths during the 4th surge alone. Dr. Scott Hamilton with the Lafayette General Hospital explains why preventative practices like mask wearing and hand washing weren't as effective in our youngest population.
Kids just love to congregate and yell and play and touch each other. And again, they're passing on virus much more easily than adults. So the basic things we do to prevent transmission of the virus, a little harder to do with kids.
Hamilton says most inoculated parents have been receptive to getting their little ones vaccinated. To those who are still hesitant, he emphasizes that this isn't our first rodeo.
We've been doing this for generations, and kids have been perfectly safe getting these vaccines. This now turned out to be one of the even safer vaccines that's ever been invented, and one of the most effective for what turns out to be a deadly illness.
Sibley says if we want our children to return to any sense of normalcy, the vaccine will take us there.
If we're ever going to get them back to learning normally, getting back to participating in their activities normally, the best way to do that and avoid future surges is going to be to have the majority of our population vaccinated.
Now, both doctors say that common side effects from the vaccine mirror that of adults following inoculation. They say avoid giving your children any medication prior to getting their shot, but if they are in discomfort after, it is okay to give them something such as ibuprofen. Reporting in Lafayette, Kenny Darr, News 15.
Now, both doctors say while it's too early to tell, there have been talks about health experts, I should say, that the COVID-19 vaccine could eventually be added to the list of immunizations required once a child is school age.